Hello, everyone. Well, we are back and happy Monday. So today we wanted to bring a topic, pelvic floor physical therapy. Most of women don't even understand what pelvic floor is. So I really wanted to bring this topic out, why it is so important for women who postnatal after they've given birth, as well as moving into the perimenopausal years. We have Dr. Swathi Reddy with me. She is a physiotherapist as well as a diet counselor in India, Bangalore, joining me live. She works for hospitals. Thank you so much, Dr. Reddy.
Thanks, Amita. Yes. So that's what, see, as you said, that's right. A lot of people are not aware of what we call it as pelvic floor muscles. So people think, okay, these are the muscles somewhere around in our body, like other muscles. But for women, especially, these pelvic floor muscles play a very important role because especially when it comes to the reproductive age and post that as well. If you want to understand what exactly are these and where exactly they're located, simple way, just sit back and when you sit back and relax, or when you're in an urgency to urinate and you're trying to control it, you're pulling back few muscles up, right from your bottom, you're trying to pull back few muscles up to control that urination. So those are the pelvic floor muscles, which kind of supports your reproductive system, to say uterus, your rectal and anal area. Vaginal, urethral area, basically from where you pass the urine, that opening is also supported with this pelvic floor muscles. That's how you control passage of urine. And even the opening of uterus, uterus is where you carry a baby when you conceive, and the continuation of the uterus is your vagina opening, right? So these vagina is also surrounded these pelvic floor muscles. So this is how it holds. So you have this urethral opening, you have this vaginal opening, you have this rectal opening. 3 openings will be there. So it kind of packs it up and then holds it up. So if these pelvic, imagine, if these pelvic floor muscles are weak, what happens? So there will be a loss of control of urination, because a lot of people used to come to me saying it's a later stage, where they take a lot of time to realize what is the condition. Then they go to the general physician, then they go to gynecologist, then they end up with a urogynecologist. So a lot of things are there, after which in the end stage they come to us this is what is happening and doctor advised to meet you. What exactly we do when it comes to this pelvic floor dysfunction or pelvic floor weakness? It can be either things, your pelvic floor muscles are stretched or your pelvic floor muscles are too tight. If you ask me, why is it too tight? There are women, in case if you are having any sexual issues also, pain during your sex, or pain after your sex or intercourse. So even this is one of the reasons when your pelvic floor muscles are not in a good strength, definitely you will have this kind of issue. The second thing, if you are a person who says, I'm not able to control urine, or when I laugh or cough, there is a leakage of urine. Got it? Laughing, coughing, sneezing, which a lot of postnatal mothers complain. This is a major complaint by postnatal mothers. And the other complaint is I'm unable, I feel like my uterus is falling off. I feel there is a complete heaviness in my bottom. So this is a complaint which people who are 40 plus or 50s, they usually complain around around the menopausal area or the perimenopausal area. I'm not saying everyone, but if you are at that age and feeling that this is the problem that you're feeling, it has something to do with your pelvic floor muscles. They're lacking the strength, so they're not able to support. So obviously the organs which they are supporting, they're kind of sagging down. There is a word called hernia, Hernia, which means the organ is a little kind of displacing from its original position. Something which is not normal, definitely kind of causes some kind of issues around the other organs, right? So if these pelvic floor muscles are weak, this is one of the things which can happen. So if you ask me, who exactly are the people who can end up with these issues? To start with, if at all a pregnant mommy is there whose baby is too heavy, or if it is a second pregnancy, where after first pregnancy, she has not come back to her complete strength in her muscles after your normal vaginal delivery. And then again, she's ending up with the second one with not more than 1 year gap. In that case, her muscles are not ready to take up that weight again. So what happens? They're going to sag. So during pregnancy, she'll end up with a lot of pelvic floor pain. There's a lot of heaviness down. She can't walk. She finds it more difficult to control her urination. Somehow she finishes her pregnancy, but post delivery, controlling urination won't be there. I had clients like that post delivery. They're not bleeding, but yes, they had to carry on. They have to use the diapers, or they have to use the sanitary pads, because they tend to leak. They don't have that control. If you ask me why, as I said, during the pregnancy, if these muscles are getting too weak, after the delivery, post delivery, after one point, there is no control. You will not, that because the weakness is so bad that you will not be able to control that urination. You don't even have an idea that you're kind of leaking. That happens with rare, but yes, in case if you're not taking care of your pelvic floor muscles during pregnancy, you can end up with that. There can be a tear in the muscle during the process of vaginal delivery. If the tear is there, and the rehabilitation, it means where after a period of time, once the stitches are dissolved, you have to start back with strengthening exercises focusing on to pelvic floor muscles. If you're not doing that, you will end up with issue in controlling urination, controlling your stools, and not only that, your uterus starts sagging. Got it? So this is one thing. And if you are a person who, with the age, your muscles are getting weak, not just pelvic floor muscles, overall muscles. So it even affects the pelvic floor muscles. Like, for example, your protein intake is less, you're not concentrating on strengthening your muscles, your fiber in the diet is weak or less, it affects the muscles. So of course, pelvic floor muscles are also the part of your body, even they get affected. So I would say there are a lot of people who are not aware of these things. They feel I'm not able to control urine, even at 40s and 50s. Okay, pregnant women and post-delivery, somewhere there is an awareness, because somehow we are trying to tell them again and again, this is what you can face. But what is happening, people who end up having hysterectomy where your uterus is removed in some conditions, where 45 plus or 40 plus, in some conditions where your irregular bleeding is causing a lot of trouble, where there are a lot of clots or fibroids inside the uterus. In that case, depending on your age, doctor will take the call. If that has to be removed, there are a lot of things which we start. So it's not like before, hysterectomy is done and then you can go home. It's not like that. So now we, each and every gynecologist is doing one thing. If you are a person who is going for that process, they first send you to us, telling that you please train her for the pelvic floor strengthening, so she will not have any trouble post-surgery. So before we train you with all the strengthening of muscles around your uterus, so your recovery will be faster. You will not have any problem with UTIs. See, even if your muscles are weak, if your vaginal muscle opening is not properly secured, you will end up having a lot of infections inside. Got it? So everything is related. That complete vaginal environment is related to your pelvic floor muscles. Okay, and these are the muscles which are connected to, I hope everyone is aware of something called tailbone, right? End of your spine bone, spinal vertebrae, end of your bone, there is a tailbone. So these are connected to that tailbone. So first thing, any injuries to that tailbone, someone sat suddenly down or fell down on their bum, they had hit the coccyx. So it kind of puts the muscles, the pelvic floor muscles, into spasm, we call it. Spasm is excessive pain. You're not able to make your muscles tight. You're not able to relax them. So in that case, no need to worry. We are there. We can help you out with the treatment, where a deep massage is done, and then also applying the ice pack, cooling effect, and at the same time trying to help you out with minimal stretches and strengthening, which kind of relaxes your muscle. Okay, deep perineal massage, we call it as, which will be done in that cases to relax your muscles. Got it? And in case of postnatal, the treatment is going to be different. In case if you're having rehabilitation is required, where the tear is there, you're not able to control. In that, we use stimulators with a very thin nodes with a very low intensity to stimulate the muscles, the pelvic floor muscles. Each muscle has to be stimulated. So it's not one muscle, it's a group of 3 units of muscles together, basically. Okay, it has a big anatomy to tell, actually, the pelvic floor muscles. It takes 2 to 3 hours to tell about it. It's that important, and it has that much importance when it comes to a female, especially. So even when we start about the perimenopausal or the postmenopausal, I would tell only one thing: you can't ignore any of these pelvic floor muscle issues. Like if at all you're a person who is finding very difficult to use the Indian toilet sitting, you kind of feel that pulling pain. You're not able to, relax the muscles around the perineal area. In that case, there is something related to these vaginal muscles which is not working out. So you need to start meeting, your physiotherapist, or if at all you're having trouble with urination along with this, you have to meet urologist. Okay, or else if you're finding it any sagging kind of discomfort inside and it is kind of putting pressure onto your vagina, meet your gynecologist. So from there, they will guide you. They will first assess you. They'll get the scan done. Then they will guide you where you need to be taken to. Got it? I personally, actually, even Amita, we all want one thing. None of the women should go off saying, it's fine. These are symptoms which are normal for women to face. No, we are also human beings, right? There is nothing called some symptom which is troubling you and it's normal. That can't be. It's just that lack of awareness, I would say. But now there are a lot of sessions that's conducted everywhere, anytime that you wanted to listen to. So try to attend those sessions, especially when something comes to reproductive system. It is always good to know what is in your body, how the changes happen in your body, to have a brief idea about it. Just in case if you relate your problem to something like that, immediately you will know whom to go and meet to, right? A lot of people are lacking that. When they have a discomfort, they're not aware whom to go and meet to, like they think general physician, or should I go to gynecologist, or whom should I meet, a physiotherapist, or should I go to a neurologist? So they start having a lot of questions and they're like, it's fine, just let me give up. So what happens? You may give up for a month or 2 months. After that, it troubles you so badly. You have already delayed it. So why do you have to wait till then, right? So pelvic floor rehabilitation is done only in case if you lose the complete control of it, or if you're not able to control your urination or stools at all. Rehabilitation, where stimulus is given, where a physical stretching of your muscles are done. In case if a person is having pain after the intercourse, no bleeding, it's just a pain where you feel that tightness or the pulling kind of sensation around your vaginal muscles. That means you're having the stiffness in the muscles, which you're not letting them relax. So even that is not good. That means you're not having the control of your own muscles. So you need to get yourself assessed for that as well. What is the exact reason? Is it some stiffness or the spasm or some tightness, just the tightness? Got it? And post-delivery also, you can't just take it for granted, because post-delivery, a lot of mommies, I know, it's kind of difficult to give time for yourself. Forget about giving time. Thinking about yourself that there is something wrong going on in your body is also very difficult. But yes, once you realize that it's something troubling you, which is not comfortable, see, a lot of women don't come forward because you kind of hesitate to even discuss these things. I'm telling you, right, there are a lot of people who are hesitant to discuss, they have a pain after intercourse. They're hesitant, when I am bleeding during my menstrual cycle, the first 2 days, I have a lot of vaginal pulling pain. right? Unless and until we really ask them several questions and make them comfortable, they don't come out. And one thing, always these things will get better when you get to discuss these things with one of your close mates or friends or cousins whom you're really close with, comfortable with. Because if they are aware of something like that, they will be definitely of helpful to you, right? If you're just sitting back over there thinking like, it is something down over there, I'm not comfortable discussing this with anyone, it's not going to work. You are going to be in a big trouble later, because the lifestyle is like that. Continuous sitting also causes a lot of stress down over there in your pelvic floor muscles, right? And always remember your pelvic floor muscles and the core muscles, complete abdominal muscles, they all are related. So always remember, that's why when we ask people to take a deeper breathing, we ask them to take a, abdominal breathing. When you're inhaling, your belly is going out. What happens? You're pulling your pelvic floor muscles in. And the opposite happens. When you're exhaling, you're pulling your abdominal muscles in, and then you're relaxing your vaginal muscles. So even in the breathing, we ask you to follow a pattern. Because if you're pulling your abdominals in and pulling your vaginals in, your pelvic floor muscles in, it creates abdominal pressure, which causes a lot of discomfort and disturbance. So even in the breathing pattern, we pull in those pelvic floor muscles when it comes to post-delivery and post that menopausal time forever. You need to concentrate. So a simple thing, I would say, if doesn't matter whether you have any discomfort with that or not, for all the women out there, doesn't matter whatever is your age and what it is, especially from the reproductive age, one thing that everyone can do simple, easy in your own place is Kegel exercise. I'm not sure how many of you are aware of it. It is the name given to the exercise only for the pelvic floor muscles. There's a simple way to do it. You can do either sitting on a chair with the proper back relaxed and straight, put your legs down, foot should be flat on the floor. Or else, if you're a person who is lying down now, you can lie onto your back, bend your knees, and then relax your back completely. Now, try to pull in the muscles down towards inside you as if you're trying to control the passage of urine. Imagine you're passing urine, you're trying to pull it in. You have to pull your vaginal muscles in. Focus should be over vaginals. A lot of people, what they do is they pull in the abs and they don't pull in the pelvic floor muscles, right? Pull the muscles inside, hold in there for 5, 4, 3, 2, 1, and slowly relax them. So like this, you need to do when your bladder is empty. First thing, you should never do when your bladder is full. Second thing, this is just the beginning. So as a progression of exercise, we also do it in this way. You pull the muscles in, hold in for 3 seconds. Pull it in little more, hold in for 3 seconds. Pull it into the more extent, hold in for 3 seconds. And slowly as you exhale through mouth, relax them completely. Okay, this is the strengthening exercise for your pelvic floor muscles, which has to be done by all the women. You don't have to wait for some condition to come up so that you can start with it. You can always do it, which is going to be helpful. And if you're a person who is seeing this, you can always tell the other women who is not aware of it and help them also in getting better, right? This is how we spread the awareness and this is how we improve our health, right? So yes, Amita. So is there anything you feel like, I'm missing on, you want me to explain in detail,
No, I think you did an amazing job in explaining, what a lot of us don't understand what pelvic floor muscles and how to take care of it. I think women are more, we are more, all of us as human beings are more concerned about the outward looks, right?
Yeah.
And don't forget about the
That's
inside
right.
also. There's something inside that's happening. So I wish there was some kind of a mirror that I can see what's happening inside, jokes apart, but we need to take care of the women, especially postnatal, like Dr. Reddy said, working into the perimenopause and menopause and beyond. so important, right? So thank you so much. You explained it so beautifully. We just do these sessions quick, 10, 15 minutes. I don't want to take too much more time, but I think this is enough to get a basic understanding.
Thanks, Amrita.
Yeah, thank you. And keep supporting us. We are coming up with very interesting programs. So we'll be in touch. Bye-bye.